Good afternoon, everybody. Thank you so much for inviting us to present. So it's a real pleasure to be able to tell you about navigatER, a mobile healthcare companion for the emergency room. And as medical students, we have been incredibly privileged to be able to enter patients' lives in their greatest hour of need in the emergency room. And I'd like to start by telling you the story about one patient that I saw a few months ago, who I think his journey really shows the ways in which we hope that navigatER can help be a tool for improved patient engagement, education, and empower them along their path. So Mr. G was a 42-year-old, otherwise healthy, Spanish-speaking migrant worker who presented to the ER after falling off a roof. He had back pain. And when we saw him, the physical exam was relatively benign, and he had a CT scan, and it turned out that he was very lucky and nothing serious had happened. So he was discharged and given a prescription. And during this visit, we saw him twice with an interpreter, once during the interview and once afterwards during his discharge. But his entire stay in the ER took about 8 hours, and when I went back to tally it up, we had spent about 30 minutes with him. And that represents 7.5 hours of time that could have been spent better. His trip to the ER was much more complicated than what I just described. He went through triage, wait time. He went to a room where he was examined, he had a CT scan, he was discharged, he was given a prescription, and he had a follow-up appointment scheduled. All of that seems second nature to us in healthcare, but to him, I'm sure he had questions, and I don't think he was able to ask. How does he do this without insurance? How long is the wait going to be? Where are the bathrooms? What is a CT scan anyway? Is his parking going to be validated? Where's the Walgreens he's supposed to get his prescription filled at? And when is his follow-up appointment? These all lead to unknowns, and unknowns in the patient setting lead to patient dissatisfaction, poor clinical outcomes, increased expense, and these unknowns lead to patient inequities.
Let's zoom out and explore the inequities found in the ER. 130 million Americans visit the ER every year. Though we imagine the ER to be a frantic environment, 80% of those who visit are lower acuity individuals who often have to wait more than 2 hours to receive care. The ER also serves the most marginalized members of our society: Medicaid, Medicare, uninsured, Spanish-speaking individuals. The Spanish-speaking individuals themselves are the ones who often have the poorer health outcomes because they have lower functional health literacy. Physicians provide less procedures and tests and medications, and they often leave the hospital dissatisfied. Keeping all of this in mind, we decided to create navigatER, an all-in-one mobile application that aims to simplify the ER process and better help the patients navigate the complex healthcare landscape and improve the health literacy. navigatER provides engaging content, process timelines, and resource maps for patients and their caregivers. The Spanish version of navigatER is an invaluable addition to the ER experience. It actually aims to reduce the functional health literacy gap that currently exists.
Now let's imagine how different Mr. G's experience would have been had he used and downloaded navigatER. As soon as Mr. G walks in, he heads to the registration desk where he is informed about navigatER and receives a text message on his phone to download and use the app. Upon downloading the app, the first screen that he sees is language preference. He selects Spanish, and now his healthcare journey can begin. navigatER was created to inform patients about the most common steps that occur in the ED, which are currently only known by healthcare professionals. In this case, Mr. G sees his first question: have you been seen by a triage nurse? This question periodically shows up on the screen to encourage him to answer the question and keep on track with the process timeline. Mr. G has not been seen by a triage nurse, so he selects no. Upon selecting no, a navigation tool opens up and directs the patient to the nurse triage station. In addition, he is informed about any upcoming tests or procedures that the nurse may perform, such as blood draws or EKGs. This is really important because it decreases the fear of the unknown, which is a major source of stress for patients in the ED. In addition, during the course of his healthcare journey, Mr. G finds out that he has to get a CT scan, but he doesn't know what that is. On the test and imaging page on navigatER, he can click on the CT scan button and get a brief and simple explanation about what a CT scan is. This is important because we're trying to decrease the knowledge gap and promote health literacy, which is really important for patients to make informed decisions about their healthcare. By the end of his healthcare journey, Mr. G clicks on the hospital map, and this directs him to the parking lot as well as to the local pharmacy where he can pick up medications. We want navigatER to facilitate discharge and post-discharge planning. We also want to encourage patients to enroll in health insurance, as well as give them access to important documents, such as a Bill of Rights. Finally, after interviewing over 46 patients in the ER, we realized there was a need to alleviate stress and promote distraction in an otherwise stressful and uncomfortable environment. In the future, we plan to partner with local cable providers and Khan Academy to produce engaging and informative content for patients and caregivers.
Given that current patient engagement and education is not readily integrated into ER settings across the country, we felt that there was a dying need to bring in ER-specific tools to improve patient outcomes and experience, decrease burden on physicians and nurses, and lead to cost savings. Based on our direct experience working in the ER, we developed this app as medical students. We talked to patients, we talked to physicians, and we developed the skeleton for navigatER. Given that 70% of Americans have smartphones, the mobile application is a perfect vehicle for engaging patients during their ER visit. There's also the potential for connecting with electronic medical records, which are prevalent in our healthcare system.
So when developing our business model, we keep as a priority the fact that we're trying to address healthcare inequities. And to that end, we don't plan on this making a profit during the first several years. We want to put all of our resources into developing content and engaging patients. We're also aware that developing a sustainable and scalable model is important moving forward, and that's where grants like this become so important to us. We've also identified other revenue streams, such as patient engagement funds from hospitals. So many large healthcare systems will set aside up to millions of dollars to engage their patients and make them more satisfied with their stay and more likely to come back. Moving forward, we also see using a subscription model in which the emergency room itself will be responsible for paying for the app download. So we think, using our analyses, that we can charge about $1 per download here. The healthcare ecosystem is also incredibly complex, and we think that enlisting other stakeholders, such as insurance providers, hospitals, and electronic medical record providers, is an important step in getting everybody on the same page. As medical students and scientists, we think it's important to show that this has an impact, that our intervention has value. And so we want to engage in rigorous study to do that. And we plan to use the survey instruments that have already been developed and validated, integrate them into the app itself, and produce publication quality data that shows that interventions have a value in this context. And we think that we can show improvement in patient engagement scores with that. So moving forward, we are planning to, over the summer, build a bootstrap version of the app on the web. And this is where YEI and the Aetna Foundation are so important and so essential. So in the fall, we plan to deploy this website into the emergency room at Yale New Haven Hospital. And in discussions with our physician mentors, they have confirmed that we will be able to reach the 100,000 patients who come through Yale's emergency room every year. Over the winter, we plan to flesh out the app form that will be available on iOS and Android, and we will be forming partnerships at the same time. So we'll be working with those other members of this landscape to develop relationships that we can use going forward, such as Epic. We'll launch the app to other healthcare systems in the spring of 2018, and we also consider future steps. So for example, we're consider a navigatER app that might be used in perioperative care to alleviate some of these unknowns.
navigatER was created by Anusha Raja, Aishwarya Raja, and Dan Shaw, medical students at Yale and Mount Sinai. We brought the clinical expertise and the network connections to the healthcare ecosystem. We also received the support of ER physicians who will remain as advisors during the development of our app. And finally, with the support of Aetna Foundation as well as YEI, we are confident that navigatER will simplify the ER process and improve the healthcare experience that patients like Mr. G will have in the future. Thank you.